everyone, so let's move towards our today's topic, which is
gastritis. Now, what is gastritis? As the name indicates, gastritis is basically the stomach. It is related to stomach, and you all know that the word, if the ending of the word is itis, that means the itis means inflammation, and the word gastric, obviously it is representing the stomach. So in gastritis, there is an inflammation of the stomach. It is divided into two types. You can say that acute and chronic. First one is acute, which is very easy and which is very simple, that it is a short inflammatory process. Obviously there will be an inflammation process. और इन्फ्लेमेशन में क्या होता है, न्यूट्रोफिल, ल्यूकोसाइट, ये सारी चीज़ें रिलीज़ होती हैं, जिसकी वजह से न्यूट्रोफिल, लिम्फोसाइट्स, मैस्ट सेल्स, ईसिनोफिल्स, ये सारी चीज़ें रिलीज़ होती हैं. वो सारा प्रोसेस होता है जिसकी वजह से आपको पेन होता है, वॉमिटिंग हो सकती है, नोज़िया हो सकता है. एंड द कॉजेज़ आर एंटीबायोटिक्स. ओके, इट इज़ यूजुअली कॉज्ड बाय एंटीबायोटिक्स एंड इट कैन बी ट्रीटेड ईजीली. But if the condition is severe, then obviously it lead to chronic condition, and that is called as chronic gastritis, which is a little bit lengthy topic. In chronic gastritis, basically what happen, it is further classified as Helicobacter pylori gastritis, and the second one is autoimmune gastritis. First we will gonna talk about Helicobacter pylori gastritis. Usually in our stomach, in the antrum part, we all know the stomach is divided into cardiac, body, fundus and pyloric part. So in the pyloric part there are further classification, further parts, which is one is antrum. In that part there is a bacteria, gram negative bacteria, that is Helicobacter pylori. This bacteria is present usually, but if this bacteria is leading the inflammation, if this is causing the inflammation, that is called as Helicobacter pylori gastritis. Okay, now this inflammation, what are the causes? Obviously this can cause gastrin production. Now we all know that if there will be release of gastrin will cause the stimulation, will cause the production of the HCl. When HCl will produce, obviously that will cause acidity in our stomach, and that will lead to peptic ulcer as well. What is peptic ulcer? I have recorded that separate lecture, you can listen that, but in short there are sores which will develop in the stomach. तो ये होता है बेसिकली HCl की प्रोडक्शन. जो हमारी बॉडी में HCl रिलीज़ होता है, ये जो HCl है, इट इज़ वेरी डेंजरस. ओके, बट व्हाट हैपन, it is very important for the digestion process. So basically what happens, there will be a thick mucosal layer which is present on the stomach, so that when the HCl will release, that will not cause much harm to the stomach. ठीक है, जो म्यूकस लेयर है वो थिक होगी, जिसकी वजह से HCl जो है ज़्यादा हार्म नहीं करेगा, ज़्यादा तकलीफ़ नहीं देगा हमारे स्टमक को. लेकिन ऑब्वियसली अगर HCl डाइजेशन का प्रोसेस हो गया, डाइजेशन के प्रोसेस के बाद भी HCl रिलीज़ हो रहा है और उतना HCl रिलीज़ हो रहा है जितनी ज़रूरत नहीं है, so obviously that is harmful for our body, our stomach as well. So what are the diagnoses? Diagnoses are obviously gastric biopsy and urea breath test. You can do that thing. And one more thing which I forgot to tell you, that in this condition, in this gastritis, urea will be increased, and because that will convert the ammonium, and there is a further process, but you don't need to remember that thing. You just remember that यूरिया ब्रेथ टेस्ट होगा, क्योंकि यूरिया का लेवल चेक करेंगे, उस हिसाब से कंफर्मेशन हो जाएगी कि क्या गैस्ट्राइटिस है या नहीं है. व्हाट आर द सिम्टम्स? लॉस ऑफ एपेटाइट, ऑब्वियसली भूख नहीं लगेगी, वॉमिटिंग होगी, नोज़िया होगा. नाउ मूविंग इन टुवर्ड्स द सेकंड पार्ट, दैट इज़ ऑटो इम्यून गैस्ट्राइटिस. ऑटो इम्यून, द वर्ड मीन्स ऑटो इम्यून, दैट द इम्यून सिस्टम विल against our body, against our useful organ, useful cells. In autoimmune gastritis, as we know, in our stomach there are some cells called as parietal cells. Okay, when those cells, obviously we know that those parietal cells will release HCl in our body. So if the immune system releases antibodies against those parietal cells, what those antibody will do, those antibody will destroy our parietal cells which are important for our body, for our stomach. अगर वो डैमेज हो जाएंगे तो क्या होगा? Obviously that is called as autoimmune gastritis. It is more common in female than in male, and this can cause neurological problems, this can cause anemia as well. Obviously anemia कैसे हो गया मैं आपको बताता हूँ. parietal cell डैमेज हो गए, parietal cells के पास ब्लड वेसल है, और अगर वो ब्लड वेसल डैमेज हो जाती है तो ऑब्वियसली दैट विल कॉज ब्लीडिंग. व्हेन ब्लीडिंग विल occur, what will happen? There will be blood loss. This is blood loss. When जब ब्लड लॉस हो रहा है, ब्लड लॉस की वजह से क्या होगा? एनीमिया होगा. एनीमिया होता ही, एनीमिया का मतलब ही यही है कि वो एनीमिया का मतलब ही ब्लड लॉस है. So obviously anemia can occur in this condition as well. So this was the whole topic regarding gastritis. Till then, work hard, study hard, and good luck. Take care. Bye bye. Thank you.